Good afternoon. Thank you for joining me today as I give you an update on the COVID situation in California. Today, I want to start by talking a little bit about our data. As we have day in and day out over many weeks and months, we've talked to you about data trends in California as it relates to COVID-19. Data have been and continue to be our eyes and our ears. Improving our data is like getting a new pair of glasses that helps us see more clearly, or using binoculars that help us see a little further out. And today we announce exciting news that California Department of Public Health will put out new emergency regulations that take important steps to improve our data collection as it relates to COVID-19, but all other reportable conditions to California's Department of Public Health. Specifically, the new data will improve our ability to collect race and ethnicity data, but also provide new information that we haven't gotten previously on sexual orientation and gender identity. I want to thank the LGBTQ caucus in particular, and Senator Scott Wiener for their tremendous partnership in working on making this announcement possible. Groups like Equality California and many others also contributed to today's announcement, allowing us to take important steps forward in our ability to see disparities and to address them with our interventions in our program. Specifically, labs and providers who collect tests, and in this case, as it relates to COVID-19, will be asked to collect information on race and ethnicity and provide that directly to the Department of Public Health. Similarly, providing options for providers and labs to report information on one's sexual orientation and gender identity. Although we are hopeful that our ongoing work with our lab and provider partners will increase the use of these data fields, we understand that it will take some time for all of our teams to assimilate to using these and reporting them to our Department of Public Health through our CalReady system. We expect over the course of the next month that we'll see improvements in the use of these fields and our ability to report out to you and to use this data to effectively see how our interventions are working and what more we need to do in California to not just address the COVID-19 situation, but also to close disparities that we've been talking about for many, many weeks and months. In particular, we are looking to ensure that the CalReady system is ready and able to collect all of this information so that as we build our future systems of data collection, that we have that capability and that we work with a number of our lab partners throughout the state to ensure that there's no issues with that data collection. And even though we know we won't get perfect and complete data initially, that we still continue to collect it, improve our capabilities, and have more to say in the weeks and months to come. I'll just emphasize also that we know that this information will not just improve our ability to have more detail on race and ethnicity. I'll remind you that about a third of our cases that are reported to California's Department of Public Health don't come with race and ethnicity data. We need that to improve so that we have a better sense of where transmission is happening, which communities are impacted, and what the magnitude of that impact will be. And similarly, and many of you in the press have been asking about sexual orientation and gender identity, today begins that day when we will have that information anew and be able to tailor our interventions and our programs to close disparities there as well. In addition to the announcement on data, I wanted to take a moment and just run through our typical data numbers in California. Today, we're reporting 9,397 cases as our 7-day average. Today's report specifically is just at 6,000 cases, which demonstrates likely a lag in getting case information over the weekend. So again, we try to anchor ourselves now to that 7-day average. And that 7-day average today represents a 2.3% increase in total cases compared to the previous 7 days. Today, we're reporting 108 deaths daily as our average over the last 7 days. This represents a just under 19% increase compared to the week prior. And then labs, we're reporting 121,288 lab tests reported, not collected, but reported today, which represents a 7.5% 14-day test positivity rate, which has been stable over the last many days. Also just wanted to spend a moment talking about some of our specific race and ethnicity data. We know early on that roughly 40% back in May, 47% of our COVID cases were among Latino populations. Today, that number is closer to 56%, which represents a significant increase of the total impact on the Latino population. Similarly, we reported in May a 6.4% impact, the number of cases among African Americans. Today, we see that number reduced to 4.3. However, when we look at deaths, the number of deaths in African Americans still, unfortunately, is twice as many, nearly twice as many as that percentage. 8.5% of our deaths recently reported are among African Americans. In the Latino population, that number is 46% of all deaths are Latino. We also have seen trends in our death numbers where both the cases, our hospitalizations, as well as deaths, we're seeing younger people suffer those grave impacts, which demonstrates that not only are we seeing more impact on Latinos, but we are also seeing a greater impact on younger Californians. And together, that important confluence really builds on why our focus yesterday and over the course of the last week on both the essential workforce and our Central Valley, in order to be able to focus on populations where we know younger people in working age, where we may have increased transmission, and a real focus, as the governor announced, with our new unified response teams and a number of people from all of state government working with our local partners, both in local government, as well as community-based organizations, faith-based organizations, employers, and many others, in order to improve our ability and capability to deliver in-language messages and really penetrate some of the important ideas around wearing your mask, remaining physically distanced, and isolating and or quarantining when you're either COVID positive or have symptoms. We also know that in the hospital realm that we're starting to see, and this is encouraging news, that overall and in certain parts of the state, the rate of rise of hospital numbers is starting to decrease, and in some parts of California flatten. But this is not the case all throughout California. As the governor often says, we don't live in the aggregate. California is an enormous state, not just from a population, but a landmass perspective, the size of 21 states together. So when we look at what's happening at the Central Valley, wherein in some other areas we see that flattening of hospitalization numbers and even case numbers, we don't see that in the Central Valley. Our 45 hospitals in the 8 counties that we discussed yesterday, we still see increasing rates of hospitalization, increasing use of ventilators in our ICUs, and really a deepened call to action and focus on the Central Valley, which is really being met by the governor's announcement yesterday, the focus on resources going into the Central Valley counties, our focus on unified response teams led by Cal OES, and a number of other California state agencies, partnering with our local agencies and partners as well to ensure that we're doing all that we can. We believe over the next many weeks, these efforts just like we did with Imperial County and that strong, deep partnership to reduce positivity rates, transmission rates, case rates. We expect these next 4, 6, 8 weeks focused on the Central Valley to really allow us to reduce that transmission and hopefully close some of the very important disparities that our data is showing us around disparate impact on Latino populations and those in the essential workforce. So together, this announcement today focused on improved data, our numbers showing some encouraged signs with our hospital numbers, but that isn't statewide, that we continue to focus on the Central Valley, that the Central Valley is a key place where we're bringing not just the efforts of the state, but together the resources that we received from the federal government and the CDC to really bring our words into actions and deepen our partnerships there. And as always, I wanna, before I take a number of the questions that I know reporters are prepared to ask, I wanna remind us, as the governor does, that among our most important tools to help reduce transmission is wearing the mask, using it as often as we can, whenever we're in larger crowds, we're going to the grocery store, we're out and about on the walk in our communities. Having that mask on or handy is a very important tool as we continue to see the evidence grow that it can help reduce the spread of COVID-19 and not only protect our families and communities, but help us move on the road of economic recovery, help us get closer to having more schools open across the state. Additionally, as much as possible, reducing and avoiding mixing in larger crowds with people that you aren't used to being around. That might include people that you're close to, close friends that you haven't seen in a while, members of your immediate family that don't live in your household. And additionally, whenever you are out, try to maintain some distance between you and others that you don't typically mix with. So those 3 hallmark things, in addition to what I give all of my pediatric patients as advice: wash your hands, and don't just wash it for 2 seconds as my kids do. Turn it on, run the water for a good 20 seconds, wash with soap, use hand sanitizer if there isn't soap and water handy, in order to reduce your own transmission to yourself and to others when you touch other surfaces. So again, it's always a privilege to be with you and give you a brief message and run through our numbers. And with that, I'll open it up to reporter questions.
Dustin Gardner, San Francisco Chronicle.
Thank you. Just to clarify, the requirement on sexual orientation and gender identity, does that apply to all 90 communicable diseases that are reported to the state? And number 2, why is this happening now when LGBT leaders started calling for this more than 3 months ago, and millions of people have been tested in that time frame?
Yeah, Dustin, so to your first question, yes, this is a requirement on all reportable communicable diseases to the California Department of Public Health. We know that we'll be, over the weeks and months to come, working with our lab partners, our providers, to collect this information as well as they can and support them in identifying strategies to increase reporting. To your question about the call and the time to get to this announcement and point, we have certainly been working on it for quite some time, really preparing our providers and labs to be able to collect this information, preparing our systems to accept it, and making sure that we invite a number of stakeholders to ensure we're doing it in the most comprehensive way possible. The last thing we wanted was to be saddled with a whole stack of data that we weren't able to turn into actionable information. And so, as many things, it took some time, and we're happy to arrive at this day when we know we're moving forward to having this data available, having our ability and the tool to use it in an action-oriented way, and to be more focused with our response.
Josh Haskell, KABC.
Yeah, Dr. Ghaly, you talked about the increase in the 7-day average of cases this 7-day versus the last 7-day. Do we need the number of new cases to go down in order for the overall picture in the state to improve, or more cases doesn't always mean more hospitalizations and more ICU patients?
Yeah, it's a really excellent question. I'll say, of course, what we're looking for is a reduction in those trends. Many people are encouraged by somewhat reduced rate of rise, but it still rises, right? Today's increase of 2.3% in our 7-day average over compared to yesterday is a smaller rate of rise, but we would like to see that number be 0, so flat, or even on its trend downwards. That said, as we identify more and more young people who are positive, we know that younger people, those without significant comorbidities like diabetes or heart disease, often need less hospitalization and often stay in the hospital a shorter period of time. So you're absolutely right in that the absolute number of cases does not always correlate or doesn't correlate in the same way today as it did before with the number of hospitalizations that we'll see or the need for ICU stays and ventilation.
Paul Rogers, San Jose Mercury News.
Thanks, Doctor. Following up on your point about masks, 2 quick questions. If every person in California wore a mask, how long would it take for coronavirus to be brought under control? And second, why hasn't the administration put in place a statewide policy to fine people who don't follow its mask mandate, similar to the way that some California cities like Glendale and Monterey have started to do, issuing those fines?
Yeah, thank you for the question. Always look forward to an opportunity to support our message around masking. Again, every week we come together. We have more information showing the power of a mask and the ability to reduce transmission. Some studies show that, if we had 80% compliance with masking, that we can reduce transmission somewhere between 50 and 60%, which is tremendous, which is exactly to the last question, exactly what we need to see those case numbers start to come down, even if we don't necessarily change the level of mixing that we're having in our communities. So it is increasingly one of the most powerful tools that we see, not just at the aggregate, but on the individual level to protect your communities, your local hospital system, et cetera. So every opportunity we have a chance to urge our viewers and our public to go nowhere without your mask, to wear it and wear it a little longer than you thought you might. Keep it on, don't take it off, so that we can really make sure we get that full value out of mask wearing. The governor often talks about running the 90-yard dash instead of the 100 yards. Let's get all the way with our use of our masks. To your question about fines, certainly the state has set up a structure wherein fines for not complying with the mask order are allowable. We've largely left that to the local, at the local level. We're seeing more and more local jurisdictions consider fines for masking or for the lack of compliance with it. And also, I'll remind you that the governor did put at risk a certain amount of funding in the billions of dollars across the state for the lack of compliance with orders around public health orders and criteria as it relates to local performance, including enforcement of certain things like our mask mandate and other areas. So it's both the local effort on the one hand, as well as the state effort that I just mentioned on the other.
Alex Michelson, Fox 11 News.
Thank you, Dr. Ghaly. I'm curious, if you would, to explain where we at in terms of therapeutics as a state. What are your feelings on things like hydroxychloroquine, remdesivir, and what would your advice be to doctors when it comes to some of this in terms of the research in your state?
Yeah, I think excellent question. I know the governor has mentioned that we will soon do a clear focus on therapeutics and advances, not just in our delivery system, the front lines of the hospital, but what some of the research and biotech community that is so important and rich in California has done to contribute to those advances. To your specific questions, hydroxychloroquine, I think early on people were curious and wondering what its role would be in treating COVID. I think today it's becoming more clear that it isn't a drug that is really first line or second line that is being used to treat COVID patients. I know that there continue to be questions and trials and literature coming out on its role, but I would say now that it isn't an important tool in the treatment of COVID-19. Remdesivir, on the other hand, increasingly used. We received a good supply from the federal government who was distributing it initially. We've used it and dispersed it across the state to all hospitals, and it so far what is reported is that, as expected, it has some impact, and we're still looking at the California specific data on reducing length of stay and potentially helping people recover sooner. As the supply of remdesivir hopefully becomes increasingly available, it will become an important tool in the treatment. And I'll just use this as a moment to remind all of you, as you talk about therapeutics, that one of the valuable and important gifts that California received out of its early actions, the stay-at-home order, 40 million Californians strong, swimming together to flatten that curve, not just buy us time to get prepared with beds in hospitals, staffing in hospitals, PPE, but it also allows us to learn how to use these new therapeutics and tools to allow our clinicians to learn from around the globe how others have treated individuals who are severely ill with COVID-19. That gives us a chance to not only reduce transmission on the one hand, but to really do a better job caring for those who become quite sick. And what we want to see, even if we had steady number of cases, and even if we had a number of people end up in the hospital, that we had fewer who stayed there for a long time or who passed away as a result of COVID because of these innovations with our therapeutics and our treatment plans and modalities.
Brody Levesque, Los Angeles Blade.
Good afternoon, Dr. Ghaly. I'd like to follow up my colleague from the San Francisco Chronicle's question, but I'd like to be a little bit more specific and detailed. 40% of LGBT youth that are homeless are in the mix, or actually it's 40% of youth that are homeless or LGBT youth, let me correct myself, are in the mix there. What are you guys doing for testing in the homeless arena, and also in reference to the overall for the Central Valley and of course Los Angeles? What is the department doing in terms of getting more bilingual testers and contact tracers out there to make better data points, if you wouldn't mind?
Yeah, no, excellent question, and thank you for allowing me to refocus the response. As it relates to testing among our homeless populations across the state, has been and continues to be a high priority. You hear about many of the amazing efforts around Room Key and Home Key and our focus on supporting our shelters with PPE and other efforts, but testing is a very important part of that. Improving our access to testing and that test turnaround time issue that we have been working on over the past many weeks as we've seen a surge of cases across the nation. It all ties in together, and our ability to get testing supplies to those frontline shelters and homeless service providers is very important and continues to be. And then making sure that we match up in a very deliberate way our homeless service providers and shelters with labs that can give you rapid turnaround time, especially in places where you might make important decisions on where to house somebody, where they sleep relative to others. Having that test result only aids in our ability to make good and strong choices. As it relates to the Central Valley question and improving and increasing test availability, as I mentioned yesterday, we see some of the highest rates of test positivity in the Central Valley. I would say that those 8 counties make up, are all on our top 15 list, or pretty close to all of them on the top 15 list of test positivity, many in the top 5, which tells us not only do we need to get a stronger message out on the importance of testing, we likely need to increase our penetration of testing sites, but also the ability to get testing into the fields outside of the typical brick and mortar facilities or drive-through facilities into our agriculture community, into the factories, and stay tuned for more on those efforts as our focus on the Central Valley with our 3 unified support teams that are going throughout and focused on increasing testing capabilities and capacity. And then no doubt to your last question, a focus on not just the sheer number of people able to participate on disease investigation and contact tracing, but to do it in language, being able to do those interviews in a way that those being interviewed understand and feel safe answering questions is a very important piece on improving the effectiveness of our test tracing supportive isolation strategy in the case. And as we see the transition rates come down, and as we see the number of staff prepared to work as part of our contact tracing disease investigation workforce, we must have people who can speak the language of those who we're serving and trying to support. So it is a very important priority, and our efforts in the Central Valley will focus on that in particular.
Sophia Bullock, Sacramento Bee.
Hi, Dr. Ghaly. I'm hearing a lot of confusion from readers, and frankly, I'm a bit confused myself about exactly how individual people should be interpreting the new testing guidance. So I'm hoping you can provide a little bit more clarity. So should individual people who are concerned that they might be infected and want to get a test, should they be trying to assess what tier they fall into? And are you encouraging those who fall into the lowest priority tier to avoid getting tested? And for those who are seeking to be tested, where should they be going? The governor has previously encouraged everyone to go to the free testing sites that the state is running. Is that still the guidance, or would you encourage people to go elsewhere under these new guidelines?
Thanks, Sophia. And I'm always happy when I hear individuals digging into the guidance that the state puts out specifically for providers and labs. Remember the announcement I made just earlier last week, actually 2 weeks ago now, that refocused not just our tiered priority for who should be testing, with a specific focus on those tiers in the face of some demands and scarce resources on the testing side, but also prioritization for which labs should be processed first by our laboratories across the state. I would say that individuals who are concerned should reach out to their providers and ask the question. This guidance is really meant for those providers and labs to be able to support individuals seeking testing to understand where they fit in to our tiering system. So I would encourage Californians who are interested in being tested to either reach out to a provider, your typical provider, reach out to one of the test sites. They often have platforms to fill out sort of either your symptoms or your exposure risk. And through those efforts, we can determine whether you should be tested immediately or whether you could wait a while to be tested. And we hope that as we increase our efforts to solve some of the supply chain challenges that we've been mentioning, and as we see potentially some reduction nationally in the amount of testing being done, and as we in California continue to increase our testing volumes, that we will see some of these test turnaround time issues improve. And we especially want to stay focused on making sure they improve for those people whose test makes a decision on how to treat them in the hospital, maybe makes a decision as to whether they should isolate or not. I think there's a number of different uses, and that's exactly why we have our prioritization tiers that we hope all of our clinical partners and our testing sites, as well as our lab partners, follow, so that we can make sure that our first tests are targeting those who, through this tiering process, need it the most, but that we create space for others to get tested in those lower tiers as well.
Final question, Brian Ghaly, Associated Press.
Yeah, hi, Dr. Ghaly. This question is about the state's data collection and the ability to distinguish between people who have had multiple tests. So I'm wondering, California's reported 7.3 million completed tests. How does that translate into the actual number of people that have been tested? If you weed out the people that have been tested twice, and then similarly, of the 460,000 confirmed infections, is that 460,000 people that have had an infection, or does that also include people who may have gotten retested after being confirmed to have COVID and then tested positive again? Or can you clarify those numbers?
Yeah, I'll try my best to, especially on your last part of your question. We'll have to get back to you. I'll just remind people early on, many people were getting 2 tests to confirm whether they were COVID positive or negative. So in the early days of our reporting, there were individuals, a single individual who had 2 positive tests as an example. Early on, many months ago, that trend started to change, and most people received a single test specimen, which reflected a single positive or negative. So we don't today expect that many of the cases that we're reporting represent 2 test positive results for a single individual in the moment. No doubt many individuals who have been tested more than once. Individuals, residents, and staff in skilled nursing facilities, where we've had such important focus on being able to, as I like to say, really guard the front door from COVID and reduce transmission. We test in an ongoing way with serial testing. If a skilled nursing facility has a positive case among workers or residents, we do even more frequent testing. So it wouldn't be surprising if a single individual in California had multiple, even handfuls of tests to make sure that they aren't a vector for infection or themselves infected in one of our high-risk areas. In terms of being able to determine how many people our many cases represents, whether there's duplication there, I'll need to get back to you so that I can give you an accurate answer on that question. So I think we've gone through the questions. I just want to again thank each of you for joining today, that we continue to emphasize our message around wearing your face covering, your mask when you're out and about in public, even when you're with people that you but haven't spent much time with. Maintain that important 6 feet of physical distance, and even more if possible, wash your hands. And especially if you're feeling like you have any symptoms consistent with COVID-19, isolate in your home, reach out for assistance and help. And I think together, as we marched once 40 million strong to reduce transmission and flatten that curve, that we can do that again in this moment and get to a place where we have reduced transmission enough that much of our activities, economic activities, back to school activities can come again sooner than if we don't do those important personal behavior changes that we continue to emphasize and hope each of you take to heart, share with a friend, and strongly hold each other accountable with. So with that, thank you and have a good rest of your afternoon.